This is the ToRAISE Questions Doula podcast, and this is Thérèse Hakoun. I'm Executive Director of To Labor, a international training and certification program for doula activists, and I am here in the studio again this week without Melanie, but I think I've kind of got a little bit of hang of being by myself, though I miss her. We are going to have, again, Carol Wade on, who we listened to, who was full of information in the last podcast about herbs and nutrition and about life. I mean, really what I got from her conversation last week was this isn't just about pregnancy, this is about life, which really relates to our workshops. I mean, that anybody who's taken our training knows that this is something I say regularly. Birth is the vehicle we use, but this is about how to live our life. So as a reminder, Carol is a practicing herbalist and nutrition counselor for over 20 years. She's a registered herbalist with the American Herbalists Guild. She has studied health education and nutritional counseling at the Gary Knoll Health and Nutrition Program in New York. And she's a graduate of the Herbal Therapeutic Study Program and the Herbal Therapeutics Graduate Clinical Program of the Herbalist Therapeutic Research Foundation, founded and directed by herbalist and ethnobotanist David Winston. So I'm really excited about finishing our conversation with her today. At least I believe we'll be finishing it. I feel like, honestly, we could talk for many episodes, and maybe we'll have her on as a guest in the future again. But today we're going to be talking about the second and third trimester, postpartum, getting some more insights from her. And we want to thank Latched Mama for supporting us. Please make sure you check out their website, latchedmama.com, and their Facebook page, and support this wonderful business. Help share the word and help others have comfort in their breastfeeding time. Stay tuned, and we'll be right back. Thanks. So, we are back again today with Carol Wade, as I mentioned, to continue our conversation that we began a week ago about herbal support. And I just wanted to welcome Carol and thank her for taking more time to cover what is a very complex, really large conversation, but so appreciative of just what you've already shared with us, and look forward to delving in a little bit longer into some other specific things. So, hi, Carol.
Hello. I'm very glad to be back. I appreciate having more time to talk about this, and I know that it is indeed a topic that we could spend days talking about. So it's nice to have even a bit of time to touch on these things, to be able to give people information, in this case, particularly doulas, to pass on to other people.
Yeah. And, just for the audience listening, Carol and I have known each other for a very, very long time. And we have talked in the past, and really, Carol actually started to design for us a program, a workshop on nutrition and herbal support for the pregnancy year. We kind of put it on hold. That doesn't mean it won't happen one day, but it is something that, as you and I have been talking through these, now going to be the second podcast, I think, this is such a class and such a need. But we'll talk more about the class that you will be offering before we finish this up. Okay.
Okay.
Great.
Okay.
So I wanted to go into the pregnancy, and again, here's what I want you to know. What I want our listeners to know is you are such a wealth of information, and you have so much to share, and you are such a really wonderful teacher. And
thank you.
Well, I really mean that. And what I want our listeners to know again is that this isn't an herbal nutrition class. This is our podcast, an introduction to this topic to give you some limited insights and to allow Carol to offer some support to use things that are helpful, and I don't know what the real correct word is, but like more benign situations. And so, I'm just going to kind of hit you, Carol, with some topics and kind of have you address them in that bullet point kind of suggestion. And because I've got 6 things right off the top of my head I wanted to cover for pregnancy that is not uncommon occurrences for those who are pregnant to have potentially happen to them. And then I'd like to get a little bit into maybe some labor support preparation, and then finally a little bit into the postpartum period. And again, I feel like we could do an episode for each trimester. We would call it 5 trimesters because it'd be the pre-pregnancy through the fourth trimester, the 5th trimester of postpartum. But so if I know it's not always easy. It's not easy for me to shut my mouth, as we can hear me lacking in doing right now. But I'm gonna guide you along, I hope, with just some more basic information, and but I want you to feel comfortable talking about what's really important. So, something that is not uncommon for women to experience during their pregnancy might be a yeast infection. Can you address that? What might be helpful?
Yes. I think most of us have experienced yeast infections to varying degrees, and they are so uncomfortable. And a lot of the approach during pregnancy is at dealing with the actual discomfort, like the swollen area that is inflamed, but also with inhibiting that infection or that overgrowth of candida, and with preventing it too.
Right.
And I will just mention that some of the things that you can do if you begin to have a bit of a discharge or itching, is to make sure that you're wearing loose clothing, not too tight pants, which in the early days of pregnancy, your clothing you might still be wearing tighter clothes. Also, to make sure you have cotton underpants. Those simple things that you might already know. When we talk about herbal support, we're looking at, as I mentioned, dealing with the discomfort. So you might use things that are helpful for inflammation and also that inhibit some of that overgrowth. So something like a sitz bath is a method that people use for a topical application of herbs, and it's very soothing. But even if you can't, and it involves sitting in a small tub, covering your buttocks and sometimes your thighs so that you can wash yourself or be seated in some of these healing herbs. But herbs that are helpful are things like candida, because it helps with inflammation, but also is antimicrobial. You can even use a little bit of echinacea root if you want to in a formula like that, but you might try adding some aloe vera gel. You might use a little bit of, and these are all topically that I'm talking about, not internally.
Right.
And you might also try putting a little bit of essential oil of lavender into that bath, or if you don't have the wherewithal to do a sitz bath or a bath, you might put it into a squirt bottle that you can squeeze onto your vaginal area. It's not appropriate during pregnancy to do douches,
right.
I think, because it can be there are other complications that can happen with that, but you can do a bath, or you can put these herbs on, and when I'm talking about putting them on, I'm saying maybe a tea that you then have a cloth or damp method of placing it up next to your vulva so that you can actually soothe it. So those are all things that might be helpful. And in addition to that, I have to throw in, minimize having things like sugars or caffeine, or be sure that you get enough rest, make sure you're drinking enough water. Those are all things that are going to be important too.
I think that's great. And I do think that the idea of soothing is really the key factor, it seems to me. I feel very fortunate. I've had very, very few yeast infections in my life, but it is something that I do remember having, that burning, very itchy, uncomfortable. And I think the burning feeling gets from wanting to itch, the infection, the irritation. And so,
exactly, and also because the skin is inflamed and raw when you urinate, the acid of your urine really exacerbates.
So a lot of
feeling.
fluids, a lot of water to help neutralize some of those acids as well would be really beneficial.
And even like an Epsom salt bath, that's a helpful thing too. The other thing that I would mention is, so often if we can nip things like this in the bud, the success rate is that much better.
Right.
And one of the things that you can do is, as soon as you feel discomfort, then in the morning and in the evening, take the time to wash your vaginal area with soap and water, and then pat it dry. Make sure it's completely dry, or you can use a hair dryer on a cool setting to dry yourself, because the candida, the organism likes moist, dark environment. So if you can keep it dry and clean, then that's going to help.
So soap and water is okay, because a lot of women have been told in their lifetime, you don't use soup. You don't use soup on your vagina. You don't use. That's probably good advice, but soap, not to wash with soap and water.
I think my experience has been to use it in the same way that I'm not into antimicrobial soaps, in the sense that in fact, now we know that antimicrobial soaps are actually contraindicated. But the action of cleaning an area, like keeping our skin clean, this is part of your body, and using soap and water and then rinsing it off very well is not a bad idea.
Yeah.
It actually is very effective.
And so I'll be transparent here. I've always used soap and water, and I've never had an issue with my vaginal area in any way. And I just make sure I rinse well. But I mean, but I know that lots of people have been told, oh, you don't do that. So I just wanted to clarify that.
And it's like everything in life. There are a lot of different approaches to health. And some people are going to say one thing, and some people are going to say another. And then it becomes up to us to what makes the most sense to us and what's most applicable in our lives as we choose which way to go. And this could very well be one of them. It's like, I'm not into douching for the most part. I think that it can be very disruptive of the vaginal environment. But there might be a time when it's appropriate to douche. Not during pregnancy, though. Yeah. Not during a pregnancy. So,
okay. Yeah. And then, sometimes if these things are not, and this goes across the board, I think, Carol, would you agree on this or disagree with me? Sometimes somebody will some people will need an antifungal cream. The nystatin or whatever it is that they recommend. I mean, sometimes things have gotten out of hand and they need some kind of relief. Is that true, or do you feel like they can get by doing these things and what are your thoughts without putting you too much on the spot here?
I think that the proof is in the pudding. You do what's going to work for you. And if the infection, I personally believe that illness or infection, the discomfort of that is a major stress on our bodies. And it's important to relieve that stress. In the same way that pain, while it is a strong signal and indicator to us that something is going on, it's long, unmitigated pain or chronic pain is a major stress on our body, and that's not good.
Right.
Stress generally is a problem, and so when you're talking about an ongoing, flaming yeast infection, do what it takes to stop it, and then do what it takes to prevent that. Prevent creating the environment that is ideal for that kind of organism to get out of balance. And speaking of stress, that is one of the things that can cause our bowel flora to get out of balance. I think that taking a probiotic, like things like Acidophilus, bifidus, those are all organisms that also live in the environment of our gut, and by gut I mean the intestines as well, but they're also present in our vaginal environment too. And so rebalancing that environment is going to be a really important tool. So yes, if you need to do some of these other, what someone might consider more heroic approaches to bring this situation back under control, then do it. As long as it, talk with your healthcare provider, make sure that it's not going to be something that's contraindicated during pregnancy. And then if especially this is an ongoing thing, then look into what's happening in your life and what might be creating the imbalance that makes you more susceptible to this.
Okay, that's great advice across the board for many of these things. So another one that is not terribly uncommon for women to have during pregnancy is a bladder infection or a urinary, more of a UTI, a urinary tract infection, more than often even a bladder infection. What's your input about that?
I think that something like cystitis is a it can be a major problem, and once again, those preventive things that I'm talking about can be helpful for keeping your body in what many people may have heard of the idea of an acid-alkaline balance, and our pH balance in our body ideally should be slightly alkaline, and certain environments can bring you to being more susceptible to something like a urinary tract infection. And so paying attention to not eating too many sweets, to being sure that you're drinking enough fluid. Fluid is really essential for so many things, but also in the case of bladder infections, it literally can kind of wash through the system so that these organisms don't have a chance to build up. But if you find that you do have a urinary tract infection, then there are herbs that are classic to use. Some of them maybe not so much during pregnancy or for a long period during pregnancy. The one that I'm thinking of when I say that is uva ursi, sometimes called bearberry, which is a really strong and powerful ally when you have a urinary tract infection. There are other things to try first, like corn silk is one of the things. Diuretic herbs, gentle diuretic herbs are very helpful. So things like dandelion leaf, especially. Nettles are also diuretic, so they're going to be helpful during this time. So that sort of thing will be what you want to utilize. And they also can be helpful for not so much the nettles and dandelion leaf for the actual infection, but creating an environment that is less helpful or inviting to those organisms is important. So another one, and actually one that has come into the press more, I think there was recently a study that said that this doesn't work, but I think it's funny and I'm talking about cranberry juice, unsweetened cranberry juice. And it always amazes me when these studies come out, because when you've been working for an extended period of time in a certain field, and you hear about something that over and over and over and over works, and then you hear from the scientific study, oh no, that's
isn't that
not
crazy?
effective.
Yeah,
it is. It always.
Well, I'm so glad you're putting that in there, because I read that same study. So many of us read that, and it's like, really? How come? Well, then what was it that was working when that woman drank cranberry juice?
Exactly. And I'm totally for placebo. Whatever works, like, I think that our minds are such powerful allies in health and rebalancing health, and that it's not something to be discounted or to be considered less than. But I think there's a physiological basis to the efficacy of cranberry juice, with rebalancing the pH in your system. And so, yeah, I know I thought that was very funny. But when I talk about cranberry juice, I'm not talking about ocean spray that has artificial colors and has
sugar,
all kinds of sweeteners, which is completely contraindicated for this situation. I'm talking about unsweetened cranberry juice, and you can even get it as a concentrate. And if it's easier for you, you can even get it as a pill, but that kind of intervention, and that would be considered an herbal intervention too, that it's one of those places where food and medicine intersect, because cranberry juice you could think of it as a food too. Right. Yeah.
And I've heard that blueberry is really good also, that some people, they actually sometimes sell. Cranberry can be a little bitter tasting, the straight good kind, that sometimes a blueberry, cranberry combination, that blueberry has very similar properties. Would you agree or disagree on that, or have an opinion about that?
I would totally agree, and I think that also the nice thing about blueberries is that you're accomplishing many things with that too. It's blueberries and dark, blue, like dark red grapes. They have a kind of flavonoid called anthocyanin that is just such an amazing tool and supplement to use in your body, or to bring into your body. It's so good for circulation. It's good for immunity. It's good for balancing your body in a very positive way. So you're going to be, a lot of these things, you're accomplishing more than one thing, unlike what's called, what might be referred to as a reductionist approach that our medical system in the United States, as it's practiced today, follows. It truly is a more holistic approach that is doing more than one thing, and you're acknowledging that it has more than one impact. So often we resort to or need to, sometimes we need to, but when we're led to use often pharmaceutical approaches to illness, there's all kinds of repercussions from those too that aren't necessarily mentioned, and then you're doing something to deal with that side effect.
Right.
And then you're doing something to deal with that side effect.
Right.
And it goes on and on. But in this case, the side effect is a positive thing. The things that are happening peripherally are positive things. So yes, blueberries. Okay. That's a long-winded of saying yes to blueberries.
Got it. Good. So you covered a couple herbs and drinks with that, and I know hydration is really important. That's why when you said you could probably take capsules, I think I'm not second guessing you. I agree. I'm sure that is the case, but I see also the benefit in the drinking is helping flush out your system too, forcing yourself to pee more so that...
Exactly.
Yeah. So
exactly.
You're getting that bacteria to move through. And I like also the idea of the preventive with the probiotics and such. And, I think yeah, that is very helpful on everyday life, let alone for during this period of time. So,
yeah, and in the case of a urinary tract infection, you might, there could very well be inflammation, and so those herbs that I mentioned, that herb in particular that I mentioned before, that is a demulcent, marshmallow root, might be an appropriate thing to add during this time, to add that, because it's going to be soothing and healing to that urinary tract.
Would slippery elm be one of those, since it's on that as well? Since you mentioned slippery that earlier.
Yes, and slippery elm is an incredible plant ally. I often will talk about some of the other herbs that are useful, because you can still get slippery elm that is grown in a sustainable manner, but it is one of those herbs that is over harvested. And I'll take this brief moment to talk about sustainability in terms of using herbs in healthcare, in the sense that when you're choosing your herbal product, or as you're buying your herbs for tea, make sure that they're grown organically, and also that they are grown in a way that does not deplete the wild population, or that is in fact a farmed population. I think that one of the I wouldn't call it a rumor, but one of the things that at least, especially when I first became an herbalist, that was repeated quite often, was that wild grown herbs were more strong, that they were going to be more effective, and they were a better way of dealing with things. But today we have a world where herbs like golden seal, which is not appropriate during pregnancy, but I'm bringing up golden seal and also American ginseng, are herbs that are very effective herbs in the area that they're used. And because of that efficacy, they've been very much over harvested. So we need to pay attention to the health of the environment for these tools that we're using also, so that we're stepping lightly on the planet, which is why I would say marshmallow root is a great one. Slippery elm powder is another one. It's one of those herbs that is over harvested. So you need to, when you need it, use it, but be judicious in the way you use it. I would also mention, though, about slippery elm, that if you try to make slippery elm into a tea, it's mucilagynous. It truly is mucilagynous, meaning it's kind of slimaceous, is an unscientific way of saying it.
Yeah.
So it is not going to be enjoyable to drink, but you might have it mixed with oats. Like when you have your oatmeal. It's also
it's kind of like those castor oily kind of things to me. It's kind of like, okay, it's good for you perhaps, but not the most wonderful thing to have to swallow down.
Exactly. So to take it like as adding it into like as what's called a cold infusion. So you're not heating it up, but you might mix it with water and you make a little gruel or paste, and then you could add that gruel into something that you're already going to eat, like oatmeal, and then take it that way.
Great.
That would be a way that your system might not object to it. Like
Good.
For myself, my gag reflex is very strong.
Yeah.
And when things are too viscous, it doesn't go down well.
Got it. We don't want to add more issues to ourselves during this time. So another one, Carol, is hemorrhoids, and it's not uncommon for it to occur anywhere in the pregnancy, or not, but anywhere in the pregnancy, including it may not even happen until somebody is pushing. But say it's during the pregnancy or any time. I think we know basically how to avoid it with exercise, good diet, fluids, movement will help with the ability not to have to strain, be constipated with bowel movements. But it is also the weight of the uterus on the whole rectal area that can create the hemorrhoids. But so what I'd like to do is address, if somebody has hemorrhoids, what are suggestions about how to help them, because literally they are a pain in the ass, because I've had them and they're very uncomfortable. Yeah, I never got them until after I got them with some pregnancies, some births while I pushed, not fortunately during the pregnancy, but it made recovery very, very hard. So I had good support around me, but what are your suggestions?
Well, I think it's very good that you predicated it by talking about some of the things that you can do to treat constipation, which can sometimes is a factor in hemorrhoids, barring what you just mentioned, which was the weight of the extra weight on that pelvic floor. But I think that herbally, things that you can do are things like sitz bath, which I mentioned before, and you can use herbs like echinacea and comfrey to use. One of the things that is helpful with hemorrhoids is to literally try to shrink that tissue, do things that are encouraging that tissue to move back down to normal size, because really a hemorrhoid is a swollen vein is what it is. It's a varicosity. And so things like witch hazel are really helpful. And you can, for this topical application, you can get the distilled witch hazel that you can still pick up at most pharmacies,
right, and
use it on a cotton pad and place it over the hemorrhoid. But you can also make a sort of like a paste or oil with actual witch hazel bark, comfrey, plantain, oak bark. Oak bark is one of the things that's what I would call an astringent, which tightens tissue. So those are all things that are going to help to not only soothe the tissue, but tighten it so that it literally shrinks in size.
So that would be applied much like the over-the-counter Ambisol or Preparation H, but instead making your own out of these bark herbs. And herbs, yeah.
Which you can either you can buy them in bulk and small amount, because you're not going to use that much, but a small amount of each one, and then you might freshly powder it, or buy it already powdered from a source that moves their herbs pretty. It's not going to have been sitting on a shelf for 2 years or 5 years or whatever before you ever get it, because it's going to lose some of its efficacy once you powder it.
Right.
If it's sitting there for a long time. But yes, you can make that, you powder those things and then you add them to some kind of oil, a healthy oil like extra virgin olive oil. I like jojoba oil. Almond oil, if you don't have a nut allergy, can be a nice application for this. But you mix the powder and the oil together and then apply them to that.
And did you say witch hazel in there as well?
I said witch hazel, but what I said also was that not the distilled witch hazel.
Oh, the witch hazel
I talked
bark.
About earlier.
Right.
Yes.
Thank you.
This is the bark.
Right.
Yeah.
Okay.
And the other one, another one that's simple, if that sounds a little daunting to prepare, is using echinacea and comfrey like as a sitz bath.
Right.
So that, so the comfrey, in this case, you're using it also is demulcent when applied topically like that, but it's an anti-inflammatory. It actually can help with pain, because inflammation often is accompanied by pain, as you mentioned, with how uncomfortable that is. So those are some of the herbal
That's great.
things.
And what I will add in that is not herbal, but I know Carol would support this I believe Carol would support this as well, which is, and this is spoken from experience, is really taking the pressure off of your bum as much as possible as you're sitting. They do make these what do you call them? Donuts to sit on.
Donuts.
Yeah, whether you have that or something just to, like a pillow on one side of the buttock to lift off the pressure, creating a softer space for that pressure. And I also do know this from experience and from other people that hemorrhoids can get almost worse in the days after the labor, because the uterus is shrinking down and it applies some more pressure. don't just keep doing those things that help support. And usually if you're doing those, the recovery will start to happen. But I've seen it for myself. I've seen it with others that sometimes day 3 or 4, the hemorrhoid can feel like, oh my God, this is just so hard. Part of me used that to my advantage as much as it was really painful. It was like, okay, don't get up and do things. Like, this is when you need to be taking care of your baby and yourself, and that's it. Just these things are happening. They suck. It's terrible, but it's a good reason not to be overdoing, because overdoing is just going to exacerbate this situation. It's going to...
Exactly.
Hemorrhoids can get really bad where they become a more severe issue than what they need to be sometimes. So yeah, minimize the amount if this is postpartum that you are doing, but it may be during the pregnancy. So,
I'll just interject that, you know, especially as we're talking about this as a postpartum event, then when you're talking about taking care of yourself and taking the time to give yourself a break, literally, a part of a ritual that I would really encourage women to have during that period of immediate postpartum is to do the postpartum bath with and herbs are such a lovely addition to that. So herbs like calendula and St. John's wort and lavender flowers, which when you add them into a bath they're relaxing. They have a lot of antimicrobial properties. They're antidepressant. So you're accomplishing many things at one time. Maybe adding in a little bit of something like myrrh, which is a very good antimicrobial that will kind of, in some way, I think of it as almost grounding that bath in a way. Those are all things that ritual is not only helping the tissues, these very, in some ways they've been abused tissues of your vaginal area, to come back to health again, to come back to not only health but normal size. And in that process, as you're dealing with the birth area, you're also, the hemorrhoids are going to be supported or supported in the sense that you're helping to move back to normal size as well, and those are all herbs that are going to be really helpful for
and
that.
Taking, yes, because we, as my experience in working in home birth, as I've mentioned, is just a normal part of our immediate recovery stage. Is within that first 3 hours or so, 3 to 4 hours after the person has given birth, we prepare a herbal bath for them with those ingredients, including, I think ours has comfrey in it as well, and there is salt in it to help with shrinkage as well. And we make it so that they can soak in it for the healing property of the physical, but also the emotional. It's like the letting go, letting the muscles relax and let the mind relax because you just did this most amazing thing. And then once we make a whole nother pot of the herbal bath for them as well and leave it on their stove so that they can, the next day take it, and it may be strong enough or just even psychologically enough for them on the third day or fourth day to do it, just so it's something that it doesn't have to be reserved for home birth. It could be something that you as a doula put together and give as a suggestion or as a gift or an extra add-on, or recommend that your clients prepare for that, that they gather those herbs, and that when they go home from wherever they birthed, that they can come home to their tub and soak in it. Sitz baths, as you've already mentioned, Carol, are wonderful and maybe all somebody can get the time to do. But then it goes back again to take the time to take the bath. because it's a time, and you can bring your baby into the bath with you if you want to. Those herbs will be lovely on the baby, or just that time where your partner or care provider is, whoever's helping you out has time with the baby, and you get that alone time and drink a cup of the tea and sit back and just rest. So I think it solves over and above hemorrhoids and, tear potential that might have, stitches or something that needed to be done. All of those things will be helped, but it's for the mind as well. So,
exactly.
You mentioned hemorrhoids being in essence like varicosities or a varicosity, but I wanted to talk a little bit more about the incidence of it is not. For some people, there's more of a hereditary tendency, or it's just their pregnancy, their body, whatever the case might be, may end up having varicose veins in their legs, and in some people's cases in the vulva, which was my occurrence for my 4th and 5th and 6th pregnancy. So can you talk about varicosities in any way?
Yes, I would, with varicosities, once again, having a diet that is helpful, that, for instance, that is rich with things like blueberries. That one of the wonderful aspects of blueberries in the diet is that it also happens to be really good for capillary strength, for the integrity of the blood vessels themselves. So doing things that are going to be helpful for that are going to be really important when you're dealing not only with varicosities, but also with varicosities in the sense of the larger, what people see as a big dark blue vein poking out, often in the back of your knee, but also the little spider veins that can begin to appear on your thighs. So things that are rich in carotenes are going to be really helpful. So once again, something like calendula will be a nice tool to use. Beets, while not an herb, are something that is helpful also for dealing with varicosities, though I would add this caveat that beets are a very cleansing food, so you do not want to overdo it. You don't want to have too much. So a small serving is what I'm talking about. Physically elevating your legs, so that you can take some of the pressure off your veins, because unlike arteries, there's no pumping action that's bringing that blood circulation back. It's like you need to kind of help with that. So massage, including self-massage, will be a helpful thing, and utilizing herbs that are soothing and helpful for your body is going to be a good thing to do. Those are the things that come to my mind immediately. Okay.
I know I will just then add in here with the vulva varicosity, it was the weight of my uterus was really pressing because I'd never had a varicosity in my vulva prior to that pregnancy. I never had them. As soon as I gave birth, it shrunk back down. And it was very painful. It was very sore. It felt like a constant throbbing, bruising feeling in my vulva. And it was not a pleasant thing. So just to add in here, and this can help, I think, also with leg varicosities as well, but I know this for a fact with vulvas, wearing a pregnancy belt, some kind of support that helps pull in the uterus more, supporting the abdominal muscles well, took so much pressure off of it. I mean, it didn't take it away. It just helped relieve some of the absolute weight that was there. And if anybody has taken my workshop, they hear me talk about pregnancy belts all the time. I think they're just a go-to for so many issues in pregnancy. So I think that they help. I think that they must help as well with the leg, just because it creates a better blood flow overall as well.
Exactly. Exactly. Yeah, I think that that's a really good thing to point out. I think that herbs that are good for circulation are going to be helpful too, like ginkgo and gotu kola are herbs that many people might think of as, oh, that's going to improve my mind or memory. And one of the reasons that they work that way is that they improve the circulation to extremities. But anything that's going to be improving circulation that's mild enough to take during pregnancy is going to be helpful also during this time too. So,
good.
And then, plenty of water, taking things like dandelion and nettles. Some of these tried and true herbs that we've mentioned already several times,
right.
They work in a number of different ways.
Right. I totally see the whole picture here. Another one that doesn't happen to all people, but certainly is not an uncommon experience as well, is herpes. And so we know that if somebody has a herpes actual outbreak during, as they're getting closer to their delivery time or at delivery time, that is not recommended for them to give birth vaginally for that concern that if the baby comes into contact with the herpes sore, that they can have some, in many cases, and a severe experience with it. So I guess more than anything, Carol, and maybe you can speak even more than that, but prevention, because people have a history of herpes. Most people come into a pregnancy already with herpes in their history. So are there things that they can do to help themselves,
yes,
potentially not have an outbreak?
Yes, and so this is where a class of herbs that you are a category of herbs that are referred to as nervies, because they tend to work on the nervous system, and very often they're herbs that are supportive of the nervous system come into play, that and also some of the antivirals. But one of the major factors with a herpes outbreak, almost always, it's a time of stress.
Right.
It's when you're really stressed, your immune system depresses because of the stress, and the virus has time to present, and so what you can do as a preventive is to help your body to adapt to the stresses that are in your life in a way that will discourage that kind of immune depression from happening. So doing things like lemon balm, skullcap, oat straw, herbs that are supportive for your nervous system are going to be good for that. Raspberry leaf, and interestingly enough, is also a good one, because raspberry leaf, which many women might have already heard of, and many of the doulas who are working with these women, is one of those herbs that serves on a number of different levels in pregnancy. But one of the reasons that it does is because it's high in minerals, including calcium. Calcium is an important player for nervous system health, and so that's something that you might include as part of what you're doing to prevent a herpes outbreak. So when you are, all of us have to deal with stress. So when you find yourself in a stressful time, up the level of those types of things, chamomile tea, like those kinds of things that help you to take a breath and take a step back and calm yourself, so that you can move forward with as much grace as you can, and also with as less stress on your system as you can. Those are all going to be really key in prevention too. Then most people, or many people who are dealing with herpes, have knowledge of the idea of the balance between a couple of amino acids that are players for this, which are lysine and arginine. So you want to increase the level of lysine in your diet, and perhaps decrease the level of arginine, which is present in things like peanuts, chocolate. Certain kinds of foods have more arginine, and other things are higher in the lysine. And so that's a tool that you can use as a preventive too.
That's great. That's really good. Okay, here's one last one that, that comes to me that we face in pregnancy. There is gestational diabetes tests that is routinely given to the pregnant person. And if somebody is diagnosed with gestational diabetes, it changes how most in the medical model of care, they will often consider that person then at high risk, and they will recommend that they go to a dietitian and that they have their diet changed and keep their glycemic index in an appropriate range. What are your thoughts? What are your conversation? And this is a huge, Carol, I know it could be a long discussion in itself, but, like those bullet points again about, I guess, prevention, I think,
Mm-hmm.
and then gestational diabetes, period, your topic.
I think that, while it's not a gift, just like some other imbalances that come to us that are hard to deal with, but they also can be like little flags and sometimes larger flags that say, hey, pay attention to this, because sometimes women can have gestational diabetes and deal with it. It will recede once the pregnancy is over, and then they think, okay, everything's free and clear. But it really was a flag for you to know that this is an area that you need to look at and to support. And in terms of diet, paying attention, of course, to having whole grain, complex carbohydrates as opposed to refined foods is really important. Especially diabetes, especially adult onset diabetes, or in particular adult onset diabetes, is something that is preventable, and it is possible to shift back to a normal blood sugar range. And also with pregnancy, while you do need to work and be in communication with your healthcare provider, you can do a lot to shift that back into a normal range by paying attention to the kinds of foods that you're eating, and by bringing in foods that you might not be eating, like bitters. I mentioned before how having bitter herbs are foods like arugula and dandelion and watercress. Those kinds of things can help your body to deal with blood sugar, not only with blood sugar regulation, but also with the craving that might be accompanying the diet that is out of balance. These kinds of things are going to be useful for that. So I would really encourage women to pay attention to that. There is an herb that can be helpful, and I will mention this, but once again, I think that in this case, because you're moving into an area that can have really major consequence, you want to be working with someone who is knowledgeable about how to use herbs, because it is good to become informed and to research and go online and find things, but you really need to also have someone who has some experience with working with it, so that you can be sure that you're doing the best thing that you can for yourself and for that baby that's growing that you're sharing space with.
And can I interject, because this is really important to me, what you're saying. This is something as doulas who are listening to really take to heart, that this is an overview. This is not training you to be an herbalist. It is important that, as we've talked about so many times, know who the resources are in your community and refer your clients to those people. An herbalist who you feel know their background, you can refer people to comfortably who are in the pregnancy year. Educate yourself maybe through that person. If this is something you're really interested in, move forward and become more educated. But yeah, I really appreciate that, Carol, that you're drawing the boundary line here too of what what we can and shouldn't do. So thank you. Go ahead. Keep going.
So some of the herbs that might be helpful during this time would be things like fenugreek, which is a seed that you might recognize from some ethnic food cooking, but fenugreek can be helpful in a small amount. Cinnamon, once again, not taking too much of it, but cinnamon can be helpful with blood sugar regulation. I mentioned blueberries as a food, but some herbalists even make, or herb companies make a product that's like a concentrated extract. So it's almost like a jam, but you take it in very small amounts of blueberry extract, and that can be very helpful. What else? I think that the herb that I was going to mention a few minutes ago is one called Devil's Club. Not claw, but club, because there are two herbs that have a similar name, but they are not the same plant, and they're used differently. But in this case, it is Devil's Club. Can be helpful with being able to regulate blood sugar in a normal range, and that's the one that I was saying. Use it under the guidance of a healthcare practitioner that's educated in the area of using herbs, so like a naturopath, hopefully, or an herbalist or a midwife that has long experience with using herbs in their practice. Those are going to be things that would be helpful.
That's great, because, gestational diabetes is not an uncommon diagnosis in this country nowadays. And I think that it's interesting, Carol. I think when you and I were having our babies many a lifetime ago, it wasn't that long ago, Thérèse, we just didn't encounter a lot of people with gestational diabetes. And part of that was we weren't being tested for it. So there was probably a lot of undiagnosed gestational diabetes. But without going off onto this, because I should shut my mouth, it has a lot to do with how we've changed as a culture in our eating practices. And our lifestyle choices, because they've shown that diet definitely impacts when somebody is diagnosed with gestational diabetes and they put them on a more low glycemic diet, eating habits, that they're in essence stop showing the symptoms of gestational diabetes. But what they've also shown is that exercise is actually the key factor. Is movement, is as much as food is, it's getting exercise, which just in its own right is just taking walks, for instance. So I think it is something that's very culturally induced at this point in so many ways. And so it's good to hear
absolutely
things that you've been talking about the first episode, now continuing here. These are things that can be done. The things that you have talked about will help hopefully reduce some of the diagnosis for gestational diabetes, but there's no guarantee. I mean, some people, it's just what hormonally happens in their body. So what do we do to support it if it does happen? Carol,
exactly.
Were you going to say something else?
I was just going to say that, it really is one of those flags that you can use it as the incidence of having diabetes is much greater with people who also had gestational diabetes. It can, it's like a clue.
Right.
It's like a clue, and it's telling you, okay, pay attention. This is an area where I can really improve the health of myself, but also of the baby that's growing inside me. And also on down the line, part of what we are as parents or practitioners is that we're models.
Yes.
We people are going to do what we do more
yes.
than what they do what we say. And
right.
so if we're modeling these behaviors that are supportive of health, then they're going to follow in that too.
Sure. And that's not to apply pressure on anyone, but it's to have that awareness and yeah, we got to take care of ourselves, and people we got to take care of ourselves to take care of other people. And if people also see that, you're giving them the invitation as well. You're inviting them to take care of themselves. Carol, I would love to, but I'm not going to. I want to talk about the postpartum. I would have loved, maybe we can do this in the future, but I don't want to get into labor inductions and such, just because, and labor, how to, get a labor going, or how to make a labor, move along. Smoother. Yeah, and move along, only because, again, I think it goes back to what we were just talking about a moment ago, that there are variables and there are things that can be looked up, and you could mention, well, this herb might help and this one might, but I don't want people to take it as permission point blank that, oh, these herbs are used, and yeah.
They're powerful.
They're powerful. They are, you're the one who, and many other herbalists that I've read or listened to, clearly define herbs as medicine. They may be food, they may be plants, but they are medicine, and they should be respected as such. But that said, before we do the postpartum, and I got to keep an eye on our time, we're just going to couple things about the postpartum. Is there something, as somebody is approaching labor, they're getting, 4 to 6 weeks out from their pregnancy. And I think often of prima gravidas, first-time pregnant women, specifically because we know their labors tend to be longer in duration. But even, for the second, and again for the fourth and fifth and sixth babies, where the uterus is a little bit more used, worn out, is there anything that you would recommend that they could take, that isn't going to induce their labor, but to support the rest of that pregnancy and maybe help prepare their body more for the labor coming, make it more quote unquote efficient?
There are a number of herbs that can be helpful, and I remember that at a period in my life when I was working more with birthing community area, that I would recommend what I would call a mother's cordial for those last 4 weeks or so of pregnancy, because it can be helpful for kind of getting your body ready for that, for what's about to happen, and also for strengthening like the pelvic floor and such. And so there are herbs like partridge berry, which is kind of strengthens the uterus, the ligaments, the tendons, and it can be helpful. Cramp bark is another one that there are other times in the pregnancy that you might use it, but cramp bark, as the name implies, is helpful for dealing with spasming and making it is one of the herbs that can make the contraction be more effective. There's another herb that is a uterine tonic called Helonius, and that is an herb that can be helpful, though that is one of the herbs that is on that is somewhat over harvested, so you're careful with how you use it. Blue vervain might be one of the things that you would include in that. So there,
would that be a combination, Carol, of these herbs,
yes,
or taking one, or you're saying like
these are in combination?
In combination. Mm-hmm.
Yeah, and when you mention that, that's one of the things that I think it's important to mention with the way that herbs work. While there are some herbalists who work with one herb at a time, herbs are one of those areas where working as a team is so much more effective than individually.
I like that. They collaborate well, huh?
Yes, they do. They really do. And where by itself it might tend to push too far in one direction, having the calming influence of another herb, or the different energetic of another herb can help to move it into a more balanced approach. It's really lovely to see the dance that these herbs can do. And it's part of what, as an herbalist, when you're working with someone, generally you're thinking about things like that, like how do they work together? We don't always know exactly how things work together, but when you've done it long enough, or when there's enough literature about it, then you have a pretty good idea of what's going to happen when you combine certain things. And so in this case, yes, using herbs in certain ways are going to be, or certain combinations is going to be more effective than the herbs by themselves. But particularly at the end of the well, we're not going to really talk about. I have there are herbs that we talk about that are helpful for use during labor, that can be useful, but you don't really, you want to, once again, know what that dance is that they do together and when it's appropriate and such. And that comes with study and experience, and you want to be really clear. One of the things that I would emphasize when you're using anything, err on the side of being conservative, except for joy. Don't be conservative with your joy. That's good. But for much better to gentle is also very effective. It's like a glacier. Think about a glacier and how slowly a glacier moves. But look at what power that glacier has. And while these herbal things that I'm talking about are not as slow as a glacier, sometimes the things that aren't as dramatic, like a tsunami, don't get as much attention, but they're powerful, and they can be very, very effective. So think of it like that, like it's not necessarily glamorous, but it is nonetheless very effective and powerful.
Well, that's great. And hey, Carol, just to finish this up, because we're getting close to the end. Time. Yeah, which I hate. But postpartum, I'm just going to ask you two specific things that if you could just kind of give, again, some bullet point thoughts about. The one would be low milk supply, and the other would be the opposite, an overabundance of milk supply that may be mostly, I guess what I want to address is right in the beginning, the engorgement that people go through. So there are some people who have engorgement, and then there are some who have low milk supply. So anything you want to talk about milk supply would be really helpful.
Okay, so things like with milk supply, there are things that are they're called galactagogues in herbal medicine. They're things that help with the production of milk, so that so that you will have plenty for the needs of your baby. And they are things like there are many things that can be helpful that are like on almost like a nutritional level, but I think that, hold on a second, I just got called for something else, but let me move back. I think that things like blessed thistle is a good one to use as a galactagogue, something that helps with the production of milk. I think anise, dill, herbs that actually also are helpful for making sure that there's not colic. These herbs can also be useful for having a smooth milk supply. And we'll come back to this too, but on the area of of having too much milk or engorgement, part of that is there's very gentle massage, but using what in herbal medicine are called poultices, and you don't even have to use an herb, but even like warm cloth placed over the breast is a really soothing thing to do. But a classic one, especially if that engorgement is starting to lead into something like mastitis, one of the things that you can do is make a poultice with something like cabbage leaf, like cabbage leaf with a little bit of potato. And one of a really cool way of applying the poultice in this circumstance that I just recently read on some site, now I'm forgetting what it was, that I thought was a very clever way of doing it, was to use a disposable diaper to make your grated cabbage or the potato, and then use a disposable diaper to hold it in, because it keeps the moisture in, but at the same time it holds it in, which I thought, while I, for most of my babies, used cloth diapers,
right.
and that's something that every person decides, but I thought that was a very good way of being able to apply that.
Yeah. But
going back to milk supply, things like fennel seed are also helpful for increasing milk supply. If you when people get to the end of lactation, but perhaps even at this point, you might even try adding something that will help to normalize the milk production. So you might have parsley, like maybe a little bit of parsley in a juice, or more than, like a food amount of parsley, because parsley is a really excellent mineral source, but it also happens to bring milk supply, minimize or limit milk supply a little bit. So you want to kind of bring it back.
But it wouldn't therefore be recommended to somebody who's having issues with not a lot of low milk supply.
No, you would not want to do something like parsley, or sage is the other one that people talk about, and sage is a very powerful way of lowering milk supply. So no, you wouldn't do it. And that's interesting, because people want, sometimes people are thinking, oh, I want to get this wonderful mineral-rich vegetable or herb into my diet because it's going to be so good for me, and it is, but it is astringent, and it will lower the amount of milk. So you don't want too much. That's important
to know. I mean, I know from weaning my last child, who was 3, and I really wanted to reduce. I was still producing a lot of milk even at 3 years old. I started drinking sage tea. And it really was powerful. And I mean, I did it with intention of she and I coming to that agreement. She was going to stop nursing. So I saw the effect on my own body. It was just amazing. So it is, I didn't know about parsley, but that's really good to be aware of as well. And then with the mastitis, we also know, and you have to nurse a lot, you have to drink a lot, you have to rest a lot. And then I love the poultice idea. And I do remember cabbage and potatoes specifically. It's like, and then you have it for dinner later on, because if you're from an Irish family, that's how it would be, potato and cabbage. But it is, it's amazing what I just remember cabbage leaves, what an effect just putting cabbage leaf on my breast and feeling relief. And it's just amazing that this plant could do this.
Exactly.
Yeah. And then lastly, Carol, what about, and we would have to do a whole nother podcast on this. So that's not we're not talking about postpartum depression, but we know that most everyone who gives birth to their baby will go through a postpartum adjustment, and they may have some of initially those really weepy days, or just the general tired or the overwhelmed. Is there anything that you can briefly suggest, for mood? And again, not talking about mood depression, perinatal mood disorders, but just really that adjustment period of time.
Yes. I'll predicate it by saying that be gentle with yourself, because of course you're tired. You've just gone through a major life event, and you're in the midst of a major life transition. And so it is overwhelming at times, and that's normal to feel overwhelmed, and it's normal when you're tired to sometimes feel depressed. And so recognize that that's almost like a situational result of what's going on around you. What you can do, though, is help yourself so that you don't stay in a depleted state for too long. So it's going to be, besides paying attention to diet and making sure that you're getting all the things that you need to help yourself be stronger and more healthy, but also things that are those nervines that I mentioned, like chamomile and lemon balm and rose petals are another one that while it's not exactly a nervine, it's something that really, rose petals are a really amazing tool. And of course you're only using unsprayed from unsprayed bushes, but a little bit of rose in a tea can be really uplifting, not only in this time but also in times of grief. But a little bit of lavender, once again, just in small amounts, is something that you can use in that. Another herb that we haven't talked about today, but that is a helpful herb too, is hawthorn, which, if you know something of herbs, you may have heard of hawthorn berries and flower being used for heart conditions, but it's also important for digestion. And in fact, in Chinese medicine, they use hawthorn mainly in that area, but also for what they refer to in Chinese medicine as disturbed shen, or, so a mood. It can be helpful for uplifting moods. So those kinds of things that support your nervous system are going to be wonderful allies during this time. Chamomile, like that. That's a really good one too. So paying attention to those things, that you're getting enough nutrients and that you're getting support as best as you can. And sometimes we're in circumstances and environments that don't lead to that. So once again, that's where we can turn to these allies that help you to deal with the stress that is in your life. It would be wonderful if we could just say a magic word and disappear all the stresses, but that's not the case.
Right.
So it's about how to help us to adapt to that stress in a healthy way and as supportively as we can.
Sounds good. Well, Carol, here I want to again thank you, but because we could have a part 3 and part 6. So I know, we're just covering the tip of many icebergs here, but I really appreciate your thoughtfulness and your ideas and suggestions and your caveats around everything and the overall, and you come from not only the professional, but from the personal level of this as both a mother and as a grandmother now. I'm sure you've been helping with your daughter as much as you needed to, as well as you were asked to. But I wanted to give you one last moment, just to tell us again your website and just to mention your program that's coming up and point people in the direction of that.
Okay. Well, first of all, you're welcome, and thank you for having me as a guest. And I will reiterate how important and wonderful a gift this is for all of us, that you have these programs that allow people to explore issues around birth and health. So thank you.
You're welcome.
Secondly, as far as contact information for me, my webpage is earthislandherbs.com. And at that webpage, you can see some of the things that are active in terms of the areas that I'm focusing on at this point. And one of those areas is the Ojai Herbal Studies program that will be starting in January, but I am still taking students, and that program is going to meet once a month for 18 months to deal with herbal studies, which will also involve getting to know the plants in the garden that we mentioned, which is the Earth Island Medicinal Herb Gardens that's on the same property that the classes will be, and also making products, so that there will be a really intimate and multifaceted involvement with using herbs as a tool for health. So, and I'm also, as a matter of fact, doing what I'm calling eco tours of the garden, where people can come to visit the garden the garden is lovely in the shape of a chambered nautilus, and they can go from chamber or bed to bed, or chamber to chamber, talking about the herbs that are good for different body systems, and then afterwards make a little herbal product that they can take home with them. So those are some of the focuses of my life right now.
Wonderful. And I want to say to those who live in California, since the course will be happening in California, please consider looking into this program. And for those who have that ability, which I know there are people out there who can travel once a month to a community to learn, please know that you should look into this as well. And then the last thing I will say is, if you ever have the opportunity to be in Southern California, in Ventura County, which is where Ojai is, it is well worth your while to go to Ojai, period. It's a beautiful little community. But if you have that ability, make sure you get in contact with Carol about maybe doing a tour of the gardens and see what else is going on, if there's any other classes or so forth happening. But it would be well worth your while. So thanks everyone for listening, and very, very many thanks to you, Carol, for giving us so much of your knowledge in such a limited way. I really appreciate it. So you take it easy.
Oh, you're very welcome. And I will add one thing. Whether you come to the garden for a tour or not, I invite you to come to the garden and sit and just enjoy.
Thank you. And for everyone also, I want you to know we'll have resources up that Carol will help supply to us, and her website and contact. And if you want on the podcast website, when this airs, and also if you have further questions about some of the things we talked about and want to do a consultation with Carol, know that she is available. She does do consulting over the telephone, and you can contact her through her website in order to, find out what that would entail. But she is available for that for further learning, at least for over the telephone. So thanks everyone, and we'll be talking to you again in another week. Bye now.